everyone, and welcome back to my channel. My name's Sophie, and this channel is chronicling my journey of living my best life with multiple chronic health conditions. Today will be a hopefully quick medical update. Quick because I do not have all of the information I was hoping to have when I am filming this, and I have no idea when I am going to get it. So I'm just gonna put up what I have, and then we'll fill you guys in when I know more. So I think I mentioned before I had gone to the dentist about this thing that's in the sort of like the back of my mouth on my gum. It looks like a skin tag. I had two dentists at my normal dental office tell me it was an abscess. Makes no sense. It's been there since like late 2021, like November, December 2021. There's no way that's an abscess. There was no abscess on the x-ray. They sent me to an endodontist who said it's not an abscess, that it was probably something like a fibroma, which is what I had suggested to the other two dentists at my regular office. So the endodontist sent me to a oral surgeon, and I am having it surgically removed on the 21st of this month, which is a couple days before I fly out for Cleveland Clinic. But I did ask if it was going to be okay to fly and everything, and they said yes, it shouldn't be a problem. They're just going to, numb the area, cut it out, put a suture in, and that'll be it. But I will let you guys know how that goes coming up in a couple weeks. Then I had some lab work done, more because I'm going to be starting a supplement from the functional nurse practitioner that will most likely affect my cholesterol levels. So I wanted sort of to know what my cholesterol was before I started the supplement to see if there is a change. And it didn't change that much from when I had it done through work. But when I had it done through work, I had not been taking my omega-3 supplement. And apparently omega-3, while it does raise the HDL cholesterol, it also raises the LDL cholesterol, which I was not aware of. So my LDL cholesterol is now back to the level it used to be, but my HDL is much higher, so my total cholesterol is higher. So we'll see what happens when I start taking the supplement that the functional nurse practitioner suggests, because it has the correct ratios of omega-3 and omega-6. And oddly enough, I am low on omega-6, which is not very common in the American diet because normally we get a lot of omega-6s in the processed foods and whatnot. So I guess I'm not eating as much processed food as I should be, or I'm not getting enough omega-6s, even though I'm eating like mixed nuts. I take pumpkin seed oil and all of that. Anyway, we will check my cholesterol in the fall and see if it's made a difference. I have not yet started the supplement. I will hopefully be starting it before going to Cleveland. As I said before, I'm just adding things in very slowly right now and seeing how I react, but no bad reaction to anything so far. I did have the abdominal pelvis CTA scan done, looking for any other areas of fibromuscular dysplasia, and there were not any. I did get a copy of the disc and looked at the images, and I did see areas of pretty obvious what looked to me beading, which is normally a sign of fibromuscular dysplasia. So I did a print screen and drew arrows, and I asked my specialist, hey, I know that there's no new areas, like what's up with this beading? Is it just because of like what phase the CT scan was at, or like what's going on? I work in the medical field. I'm always curious. I want to know everything about everything. That's just how I am. And she basically said that the areas were much too regular to be fibromuscular dysplasia, and that it's just something with the way the CT scan got the images, but that it is not fibromuscular dysplasia. So I don't know if I am diagnosed with fibromuscular dysplasia, because she said if I didn't have any other areas that we wouldn't really be able to be sure with all my other weird connective tissue things. but treatment is the same. So with that, I will have another in-person appointment with her in 2024, sometime around March. And then we'll talk about imaging my brain and neck again, just to see what's going on there, because we did not do the brain this time since I had an MRA scan in 2019 and there was nothing then. So we'll see what happens next year, and until then it's just the baby aspirin that I was prescribed and following the restrictions that she gave, which I'm mostly following. I'm not completely following, but that's another story. Back to the lab works for a second. I did get some urinalysis studies and tests done because I'll be seeing the nephrologist in August. I was hoping to get a good, updated measure of, the protein and albumin in my urine, and it is literally one of only 6 times in the past almost 10 years where the protein in my urine has been normal. The other 20 odd times it has been elevated, and the albumin in my urine, this was the first time ever getting it checked, it was also normal. So I'm mildly frustrated that, I'm trying to do the test beforehand so the doctor has something to look at and they don't cooperate. The one time you want things to be abnormal, they're not, and when you want things to be normal, they're not. Their body just never cooperates, which leads back to the CTA. So some incidental findings of the CTA: both of my adrenal glands are mildly enlarged. I have a small pericardial effusion or fluid around my heart that should not be there. And the contrast when injected refluxed into my inferior vena cava as well as my hepatic vein, which it is not supposed to do. So the radiologist, in his interpretation, he said the reflux was probably because they pushed the contrast too fast, rather than I have an issue with my right side of the heart. But as we know, I actually do have an issue with the right side of my heart, but I am not going to push the issue because when I go to Cleveland Clinic, supposedly, I'll get to that in a minute, I am supposed to have the invasive cardiopulmonary exercise test, which will be looking at right heart pressures, and I will be seeing my cardiologist, so it is something I will bring up to him. And then when I asked the vascular specialist if I should be following up with anyone about any of these incidental findings, she said she didn't really think so, but I could run it by my primary doctor, and as we all know, that doesn't go anywhere. No one does anything. So we'll see what happens at Cleveland Clinic. I will let my functional nurse practitioner know about the enlarged adrenals when I talk to her next. I don't know when that will be, probably a couple months. My budget is none too happy with all of the expenses that are coming. Don't really know how things are going to work out with that, but I will figure it out somehow. So that was the CTA and the results there. More to come, maybe, if doctors do anything. Cleveland Clinic. So that is what I thought I was going to be talking mostly about in this video. It's already 9 minutes long, so maybe it would have been a separate video anyway, but I don't really have an update for you. I had the appointment with the interventional pulmonologist. He does have my 3D stent in hand. I did not get to see it. I will see it before it is placed. But he wants me to, at the time of our meeting, which was Monday, July 3rd, he wanted to be able to schedule me to see the thoracic surgeon who would be the one doing the surgery if that's the route things go. So that's why the stent trial wasn't placed, and then on either the 4th or the 5th of July, they had another sort of thoracic case conference thing where my case was presented and took up half the time. And they came along with a lot more questions and things they want looked into. and this is all more geared towards like surgery. So I'm not really sure why we're like skipping the fact that like we still need to do the stent trial. We still need to see if it makes a difference. I still need to say it makes a big enough difference to want to go through with surgery. So I kind of feel like we're getting way ahead of ourselves with some of this, but nonetheless, they want me to see the geneticist there. They might want me to see an aorta specialist because apparently the space between like my rib cage and my spine is like narrow, so even though my aorta is like normal size, it may be like large for my body, so it could be pressing on the trachea. Again, none of this is new. I haven't had new scans or anything, so I'm not sure why at the like 11th hour everyone's like, oh, we need to do all of this new stuff. But here we are. So I'm sort of waiting for everything to get worked out. The stent insertion is currently scheduled, but that may change. The pulmonary function tests are rescheduled. That may change. I have no idea what's going to happen that week at all at this point. They're trying to get me in with the geneticist. They're trying to get me in with the thoracic surgeon. They're talking to the doctor who thinks I have hypomobile EDS. I don't know what all is going to happen. So that I will update you guys on when I post the video on the 21st or the 22nd, that Saturday, which I will also update you guys on how my oral surgery went. But that is going to do it for the medical update. I wish I knew what was happening at Cleveland Clinic. Everything is all up in the air right now. They know I'm coming, they know it's scheduled, and they know they do not have a lot of time to get things worked out. So it'll be interesting to see what all happens. Currently, other than the stent placement, the pulmonary function test, then I have a cardiologist appointment. I'm supposed to get the invasive cardiopulmonary exercise test, and then I'm supposed to have the stent removed. And then on top of that, I may have the appointment with the surgeon, an appointment with a geneticist. And then the last time I spoke to someone there, they didn't mention the aorta specialist, so I don't know if that'll happen. Again, everything is sort of up in the air, seeing what we can throw together in 2.5 weeks. 2 weeks, really. But we'll see. Anyway, I hope you guys are having a good day whenever it is you're seeing this, and I will talk to you guys next time. Bye, guys.